to let everyone know, for folks who don't know about what Precious is doing for our graduate program, students oftentimes take either a thesis approach or a project approach, which Precious has taken, which is more of an applied kind of cumulative experience for her master's program. What's really unique and challenging is that not only did she do very much kind of the applied campaign development and almost the implementation side, but she also had decided to back that up with empirical data collection, almost the equivalent of, kind of a pretty significant master's level empirical study. So today we get to hear a little bit of both worlds, both the empirical research side, but also the applied side of how she turned that data collection and understanding into some real world health communication work. So I'm excited. Go ahead, Precious, take it away.
Thank you so much, Dr. Lu. My name is Precious, and today I am here to present the work that I've been doing for about a year and a half to my committee and my friends here who are here to support me. This project is called Obabo. And what Obabo means is the chest of a woman. And we use this word because it represents a lot in the African society. The chest of the woman is a nurturer. It is as a source of beauty, as a source of enjoyment for partners. And so it is an important aspect of a woman's identity. And so breast cancer being something that is not fully understood in the Ghanaian context, affecting the beauty of a woman makes it a little bit of a mystery. People do not really understand how it comes about, what are the risk factors for somebody to have breast cancer. And so making it something that is a spiritual effect is, I think, the most sensible thing to do. And so that is how come we decided to use Obabo as the theme for this project. If you look at the screen right now, you will see a generation. And this generation represents the stories that is told in the African context. Usually, the older person in the family is the authority in the family. They are the ones who are the custodians of what everybody knows in the family. They share stories that connects with real life situations and make a moral understanding of it. So having the grandmother sharing how the woman can take care of herself to her daughter, and her daughter passing it down to her daughter and the generation after. And so when I saw this picture, I was like, wow, this is great. We can use something like this. And so also thinking further into the project that we worked on, I also saw that, that is in the past. Now Ghana is shifting. We have internet, we have websites. And so it could be the younger ones who will be sending the message up to the older ones. And so it is like a transactional kind of communication. The older ones tell us what we can do, and the younger ones tell us how to do it better with technology. So I partnered with MaudLokko Breast Cancer Foundation. I'm a student at SIUE and also a citizen of the Republic of Ghana. All right. We will move on. So I will introduce myself. My name is Precious Osei. I am an applied communications studies master's student, and today I am defending my project. I'm excited. I come from Ghana. I was born at where the star is, somewhere close to the green. And then when I started my nursing education, I moved to the green part. And the green part is closer to the coast, and a lot of people live there. It's called Accra. and Cape Coast and so many places. It's wonderful. From nursing training, I moved on to African University College of Communications. I worked in the nursing field for about 7 years, and I decided that I think patients need to be more informed about certain diseases in Ghana so that they can better take care of themselves and make better treatment choices. When I went to African University of Communications and Business, or they changed the name. When I was there, it was African University College of Communications. What was the business? Okay, there was no business. So yeah, I went to AUCC, now AUCB, and I did strategic communication, and I really enjoyed it. But my health background was really hunting me, so I said, let me just do something and specialize in an area that would really match what my interest is in. And so yeah, here I am today trying to get my degree, hopefully. Before we move into this project, I would like for us to watch a video. And I would give this video to MaudLokko herself, the founder. She did the voiceover. She also went to AUCB, and so she's also a communications professional. All right, let's enjoy.
Fufumlin flani gbo ni wo wole breast cancer eji hela koni ngbaje nkoji eju efe na ni eji cancer koni nye Ghana ye ahie ke ibale cancer gbele e lojuna ni gbe Ghana ye titiu bomoden ni ofufo le hitram keji o tra hida nyonko meke ogboyi ani femo na obana alo ba yose akekpo ebanilo popakomi ke ale no ona na kaibeja no to na found and no ya hela chamo here ni oya na wellness clinic bi ameba chombo boni abako isa okwele ni ona kejiloko eba folehi no le akeke anale mla ihichaba ye agbene hu keji oye afi ni ma eje ni 40 years ke ya se sakeda o dan afikumi oya ilachamo ye shikume ni akwo ofufo mi abafi loko na chole mammogram ahabu kuni akena keji fufo ekashujuba keji fine kumi ye epata keji mmeko ebami nesa na ebami keke chamo enyese no liake ne kegbeja no to me ke ehisanjin kokumi ne ubana ye www.MaudLokkoBreastCancer.org. Hsien fendo tawo bie ubana ye jemeke di ope internet em. Bomoden no here ayo fufo ene obabo yo chichi wombo wo ye moden ni ye na wala ni wo fu breast cancer kuse.
So what you just watched is the video about breast cancer, informing Ghana women to take breast cancer seriously, practice self-breast examination, and also if they are 40 years and above, they can visit the hospital to get their mammograms. And Ga is a language that is typically spoken in Accra, where I showed you on the map. And personally, I don't speak it. So yes, my husband is Ga, but I don't speak it. I speak a different language. So this is also to speak to the diversity of how things are understood in Ghana. The messages that we share about illnesses or diseases has to identify all these different kind of languages that people speak, and it makes it really hard to do so. So I don't know what we can do about that, but maybe future research can solve that issue. Today, we will be looking at a little bit of the background. I know we've already done that in my proposal, but we will still look at it a little bit. We will consider this problem, a little bit of the literature review, and then we will look at the research that led to how we were able to gather all the data that we used to produce all the deliverables. And then these are some of the deliverables that I and Dr. Lu worked day and night to produce. And so, breast cancer is a type of cancer that starts in one or both breasts because a cell in the breast grew out of control. And I mean, that means if you're a woman and you have breasts, you are at risk, right? Yeah, you can't control what the cells do. So the problem of breast cancer in the world is really phenomenal. In 2022 to 2023, we have roughly 2.3 million of new cases diagnosed with 670,000 to 764,000 deaths annually. And you will ask me, Precious, this is global stuff. But how does Ghana, partake in this? Well, PubMed says that in Ghana, approximately 5,000 new cases and over 2,000 deaths are recorded annually. And that is not enough. 80% of all new cases are diagnosed at the advanced stage, at the stage 3 or stage 4. And so really it prevents Ghanaians from surviving after 5 years. The 5-year survival rate for breast cancer in Ghana is below 40%. Yes. And if anybody is on here and is not in the medical field and does not understand 5-year survival rates, it means that after a person is being diagnosed and go through the treatment and get out of the treatment, will they survive after 5 years? Will they or will they not? In Ghana, usually they don't. So this is a big problem. Breast cancer in Ghana has, over the years, evolved. Initially, it was something that was caused by spirits, and then it became like a curse. And then now people are getting the awareness that breast cancer is actually a disease. But awareness of breast cancer actually occurred in 2011 in Ghana. So it is fairly a new idea that people are trying to push out there. And when I checked some of the literatures and what other people have done so far, I came across one that was by Akin and Azuzet. Interesting name. They conducted a study that looked at the perceptions held by people on breast cancer and highlighted that the perception of breast cancer within the community is often reinforced by elders and religious leaders who have significant influence. And I want you to keep this in mind because that is what is going to inform our theoretical framework. Significant influence of elders and religious leaders, right? The second literature that I also looked at is how gender roles and access to care work together. So I always share this story because it was so fascinating to me the first day that I heard it. My team and I, we went out to do breast cancer screening for people because why not? And then we met these women. They were very interesting. We had a great conversation. It wasn't, they were educated women. They have their businesses. But when it was time for me to introduce them to getting screened, they told me that they cannot get screened because they need their husband's permission. So I was like, oh, okay. And then quickly we try to let them know what goes in there when you're getting screened and what we are looking for. And if we find something, what you can do after that. But it got me really to think about this situation, because if getting screened is a problem, then going for a regular checkup is a bigger problem. Um, and SACA also investigated the link between women's decision-making autonomy and breast cancer screen uptake. And they conducted a survey with a sample of 15,000 women. And the study found that significant predictors of high screening rates are education, employment, health insurance coverage, and regular radio exposure. So that was an eye-opener. Radio, huh? So what does all of this mean? What this means is that first, there is a problem. Secondly, there are things that are fueling the problem. And so how can we try to do something, send a message out there about breast cancer without letting it be too much for the culture context, without the husbands feeling like, oh, going all the way and exposing yourself to somebody you don't know isn't fit for my beliefs, right? And I really did think about this, to be honest. And I had a question in mind. My question was, how can I create breast cancer campaigns that seeks to educate women using the voices of community leaders, but also it's easily accessible at all times? And I thought about it severally. And what came to my mind was, how about we use a website? Well, I know that a website sounds like, what about all those people who don't have a phone and have a smartphone? How are they going to implement this? Well, this is for a client who has a website. And so the client has people who view their website. And so for now, we will target them. And as we move on, we will find better ways of dealing with others who don't have website. I mentioned earlier for us to keep in mind about the framework that we'll be using. And Dr. Lu and I, well, mostly Dr. Lu, he advised that diffusion of innovation theory is a great theory for this project. And I thought it through and I said, yeah, this could be true. Because if we have the elderly in the community sending out messages, then we can use them to be the ones to start the whole campaign. Why don't we adopt our survivors who already advocate to be the ones to start showing women how to access information on websites? Why don't we let them see the importance of having the website? They can access the website at any time in the day in the privacy of their room. They can watch the videos, they can watch it with their partners, and they can do it together. So this diffusion of innovation theory was a great theory that really fits, the culture differences in Ghana, and also how we can easily get things moving. So we use the innovation of diffusion theory, and then these are the objectives that we wanted to achieve. I know it's a lot of words, but for women, we were hoping to get an increase by 30% in behavior, in knowledge, and also in their efficacy. And then for the family, we were also hoping to achieve a 20% decrease in, decrease in their perception of what mastectomy is, and also an increase in their understanding and how they engage with their partners when they are diagnosed with breast cancer. So we embarked on a formative research. Oh my God, English is dealing with me today. So we started with understanding the lived experience of the participants. And also, as I said, we partner with MaudLokko. I'm going to go further into that. And then we had participants who were selected through purposive sampling because we wanted specific kind of people to represent us. First, they have to have been diagnosed with breast cancer. They should have had treatment. And second, they should speak English because my research questions were in English. So they were purposively sampled from the MaudLokko Breast Cancer Foundation. And then we did IRB. It was recorded, transcribed, and the thematic analysis that was used was Brown and Clark's 6 stages thematic analysis. So why did we use MaudLokko? First, MaudLokko Breast Cancer Foundation is a well-known within diverse women organizations. Secondly, they have an existing website. And thirdly, this is supposed to be like a kind of a negative, but a positive, appeared 5th on Google search platform when I searched the keywords breast cancer in Ghana. So I don't know if a lot of you are familiar with what SEO means. So when you open a search engine and you type keywords, what comes 1, 2, 3, 4 is very important for anybody's business. If you're graded below, there is a high chance of people not really using your website because people really just want information. They brush through it and like, oh, I think I'm okay, and go away. So how could I also use this project to bring MaudLokko Breast Cancer Foundation up on the search engines? So that was a good and a bad, but it worked out. I would like to view, I hope so, the MaudLokko Breast Cancer Foundation's website currently so that we all have an idea. So this is the About Us page of MaudLokko Breast Cancer Foundation. This is great because it gives us more room to be creative. As it stands, the website is really simple. Most of the images on the website are not a representation of Ghanaian women Ghanaian women. It's not. I think it's also a little bit wordy. Here are their executives. They're so amazing. They are doing amazing work. Okay, and this is where you click to donate. So this is the website. Meanwhile, when we search other websites like Breast Cancer Now or American Society of Cancer, we will have a lot of information for people who use the website. Over here, all they have is about us, donate, contact us, and give. Also, same as donate. So what can we do? And that is why we decided to use MaudLokko Breast Cancer Foundation. Over here, during the interview stage, I engaged 6 women. These are the ages that the participants had. Their tribe is Ga. It's just one woman that was an Ewe speaking. All of them, apart from this woman, had first stage cancer. They all were second stage, third stage. Most of them have had mastectomy unless the one who had the first stage had lumpectomy. And the difference between lumpectomy and mastectomy is that mastectomy, they remove the affected breast. Lumpectomy, they take out the lump from the breast. So they don't really lose their beauty, quote unquote. Yeah. After I did the after I did the interviews, I had to jump on doing my thematic analysis, which was really fun. I used the Brown and Clark, and I familiarized, generated initial codes. I clustered the codes. I reviewed them for accuracy. I articulated each theme, and then finally I integrated it. And some of the myths that came up, some of the themes that came up, one is myth and information. This one. That's why I use these little humans. So myth and misinformation about breast cancer and treatment. And one participant said, when somebody has breast cancer, it may be spiritual. Maybe somebody has done something to you, or it's a spiritual sickness. That is one of the participants telling me what they have heard breast cancer means. We also had the fear of breast cancer, mastectomy, dying, and its impact on femininity. And that is this one. It says, she said, if there is a program and I must travel, I don't mingle with people. I want the room to myself. Even if we are in the same room, I find it challenging to let them know that this woman has one breast. That was pretty emotional when I learned that. And then there is no knowledge in practice of breast self-examination. And that one says, you hear about breast self-examination on the radio occasionally, especially in October. And then after October, that's it. I must do the self-examination, even though I don't know what I am looking for. I'm just doing it to see if there is anything in the breast. I wasn't even understanding the whole thing. And then we have gender decision making and limited autonomy. And this was found in a lit review, and it also came up in my interviews. The woman said, even for my business, when I came back from the hospital after getting a chemotherapy, I was cooking for the children. One time, I was driving the banku. I didn't change this. Banku is a food that you have to stay awake. One time, I was driving the banku, which wasn't easy for me. I didn't have anybody, so I had to do it by myself. And then there is another one. Oh, it's covered. Sorry, guys, I'm going to mute you a little bit. Put you right there. Oh, okay, over here. And then the next theme is survivorship. She said, but when you know a survivor, it becomes something altogether different. Even if you haven't decided to go for treatment, seeing a survivor can change everything and help them decide. Okay. And then the last one is stigma and isolation. Breast cancer is highly stigmatized and mystified. And yesterday I was talking to a friend who told me that he had stroke. Yes, and he's also telling me that people don't like you when you have stroke. I was like, oh, no, people don't like anybody who is not like them. So for me, she said for the survivorship is for me to find a survivor was not easy. In fact, they would not even come because of the stigma. They don't want anyone to know that it happened to them. They will not even bring themselves to encourage others. That was deep. And after I heard everything, I said, say no more. I am here to deliver everything to solve this problem. Hopefully. So we shall move on to the deliverables. When we looked at the breast cancer, MaudLokko Breast Cancer Foundation's website, we found that it lacked some few backlinks that would help them to be others who access the website to be able to have more information that would actually prevent misinformation. And so we decided to look into 5 international and national breast cancer nonprofit organizations who have websites that we can kind of copy or even link to our website so that people can get easy information. And we looked at the National Breast Cancer Foundation. Their website really create content around more resources, educational information. We have the Ghana Breast Society. They do more of demystifying the myths around breast cancer. We have Run for Cure. Their content is about fun, running, 5K walk, stuff like that. We have Susan G. Coleman. She also is involved in the fun side of breast cancer and providing diverse information for everyone. And then we have the Breast Cancer Now, which is actually a UK-based cancer foundation, and they support women. They have free nurses on their website that people can reach out to. So the idea of having this is that we will use them as backlinks for the website for MaudLokko, where if people want more information on this, they can click it and it will take them there. If they want more information on running events, fun events, whatever, they can find it there. We were also hoping that we can use this one as our copycats. Since they are like the best ones around, we can use them as our copycat and then follow what they do. Here are the creatives. So I promised I was going to make educational models. I'll make flyers. I'll make educational pamphlets. We will have the social media calendar that is going to guide all the things that we do, and then also videos. Which one would you like to see? There's a whole lot of them.
Dr. Cheah and I, we've seen all of them. For the sake of time, does anyone in the audience here have a particular one that we would like to see?
Yes.
We probably can have time to click on one of them.
You can choose the best one.
Yeah.
So, okay, let's watch a video. Videos are fun. So the first one was a Ghana video because the women that I interviewed, all of them were Ghana except one. That informs me that there are more Ghana populations within the organization. So something that they would understand easily would be great. And then we have the English version.
Breast cancer is the most common cancer worldwide, the most common cancer diagnosed in Ghanaian women, and the leading cause of cancer death in Ghana. Be mindful of your breast by checking for any signs or changes through a monthly self-exam, ideally 5 days after your period. Remember, visiting a local clinic for an ultrasound scan is also a good idea. If you are over 40 years, schedule a mammogram at a nearby healthcare facility once a year. Detecting breast cancer early gives you the best opportunity for successful treatment. Speak with a survivor today. Visit www.MaudLokkoBreastCancer.org. The MaudLokko Breast Cancer Foundation is here to support you. Obabu, your breast health is your priority.
Breast health is your priority. You take care of it. Okay, so that is one deliverable. I have the social media calendar, which Dr. Lee is very much interested in.
I am in, yes. So click it out. Let's see what it.
Okay, here. So these are the creatives that I found on the social media calendar. Because because people access the website through mobile phones and also the desktop, most of the deliverables are diversified. So this can perfectly fit a phone screen to they can use it right on your phone. It's easy accessible, and then it can be a reminder. So you set a reminder. And the stigma, got it? Yes. And it's gonna be Friday, October 8th. And the time is 8/8. Okay. There is this one that talks about awareness. Have your breast checked today. So, and this fits perfectly with the phone. This fits perfectly with the phone as well because it's going to go on social media. It has common breast cancer myths, and then it tries to break down the myths for everybody. And this is a social media calendar. So for the first month, we will be dealing with the theme low knowledge and practice of breast self-examination. So everything that we will post in week 1, 2, 3, 4, and all the hashtags that we will use will be for that theme. And then for month 2, we will be looking at culture and spiritual myths, and then we will post about breast cancer courses and symptoms, trying to actually demystify it week by week. And I said that this project would run for 6 months, but that is over ambitious. I don't think we'll be, but I mean, 6 months of constant messaging about breast cancer on the website and social media can make a good impression on the people. Okay. All right, so let's move on to almost the end of the presentation. Right. Before I did all of that, I tested the message. I used the SMOG, simple measure of go to God. So I used that to test, and I did that by counting the first 30 sentences and the sentences in the middle, first 10 consecutive sentences in the beginning of the message, the text that I used, and then the 10 in the middle, and then the 10 at the end of the text. And then I identify the polysyllabic words, I circled them, and then I calculated the square root of it. That was a lot of math, but I did it. And then how this is going to be evaluated. So in a campaign, we have 2 kinds of evaluation. We have the process evaluation and the outcome evaluation. For the process evaluation, since it's going to be basically on the website, I would first go with Google Analytics. Wait, I have Google Analytics somewhere up in here. This is actually not MaudLokko Breast Cancer's website. This is an example of, because I don't have access to the website yet. So using Google Analytics, I will be able to look at new users. I will be able to look at the number of visitors, engagement metrics, how materials are being distributed, public inquiries. If people have questions, I can look at that. And I can also connect social media to it, so I can also look at how well it's doing. And when I know how well the website is doing and the social media is doing, it will automatically reflect on the SEO, which is the search engine, where it will have the name finally move from the 5th position to maybe the 3rd and maybe the 1st. You never know. Yeah, so that is how I will be doing the process. Thank you. Process evaluation. And then the outcome evaluation, I will be using surveys and focus group to understand how everything is going, check their knowledge on breast cancer, audience attitude towards breast self-examination, and breast self-examination efficacy through focus groups. Okay. The next. So after everything, I shared some of the things that I created with the people that I interviewed. And the first person was like, I have watched this over and over again. You are such an amazing blessing to MaudLokko Foundation. We are deeply grateful. And then the next person said, I have understood everything and I'll be posting it on my WhatsApp status. And then the first person said, wow, thank you so much for doing this for us. Now, when we go for our Wednesday morning talk, we will have something to share. The next was, I like the Gan version because most of us speak Gan. It will make the whole thing easy. All right. And I got 5 stars from that. So, in conclusion, I would say that if you want to take care of yourself, do it the Obaba way. Thank you.